If you have been told you have Hashimoto's thyroiditis, you have likely also been told that it is a one-way street, a progressive condition that will inevitably lead to a failing thyroid, a lifetime of medication, and a future of managing fatigue, brain fog, and weight gain. But what if that narrative, as widespread as it is not entirely accurate? What if the source of your fatigue, your sluggishness, and your brain fog is not a failing thyroid at all, but something far more common, something happening further down? In the intricate ecosystem of your digestive tract, there is a profound, often overlooked connection between the health of your gut and the function of your thyroid. And understanding it may change everything you thought you knew about your health. You are listening to the Longevity Library, where we archive the wisdom of healthy aging. The Gut-Thyroid Connection, a calm, evidence-based guide for the 50-plus adult. Welcome. We're going to spend some time today discussing a topic that generates a significant amount of confusion and, frankly, unnecessary anxiety: the relationship between your gut health and your thyroid. If you are over 50, you may have been told your thyroid is to blame for fatigue, brain fog, or weight gain. Or perhaps you've been diagnosed with Hashimoto's thyroiditis and fear it's an irreversible path to a sluggish metabolism. We are going to examine this connection through a calm, evidence-based lens. Our goal is to provide you with a clear understanding of the biological mechanisms at play, separate fact from fear, and offer practical, actionable insights. We will focus on what the research actually tells us about the prevalence of these conditions, how they interact, and the logical steps one can take to support overall health without falling prey to sensationalism. Section 1. Rethinking the Thyroid Prevalence Paradox. Let's begin with a foundational truth that often gets lost in online health discussions: the statistical prevalence of gut disorders versus thyroid disorders. Hypothyroidism, an underactive thyroid, affects approximately 2 to 3% of the population. It is a real and manageable condition. However, digestive disorders, specifically irritable bowel syndrome, IBS, affect about 20% of the population. This means gut-related issues are orders of magnitude more common. This statistical reality has a crucial implication. Many symptoms commonly attributed to a failing thyroid, fatigue, constipation, brain fog, low mood, are also hallmark symptoms of gut dysfunction. The symptoms are the superficial link. A person can experience severe fatigue from small intestinal bacterial overgrowth, SIBO, just as easily as they can from hypothyroidism. Because gut disorders are far more prevalent, they represent a statistically more likely root cause for these generalized symptoms. This is not to say thyroid conditions are irrelevant. It is to suggest a logical clinical algorithm. When faced with a constellation of symptoms like fatigue and brain fog, it is statistically prudent to first evaluate the more common variable, the gut. For many individuals, addressing underlying gut issues can significantly ameliorate symptoms, sometimes reducing or eliminating the need for thyroid medication altogether. Section 2. Hashimoto's. Understanding the real risk of progression. For those who have been diagnosed with Hashimoto's, or thyroid autoimmunity, it is important to contextualize what this diagnosis actually means. It is frequently portrayed as a ticking time bomb, an inevitable march toward full-blown hypothyroidism that leaves a person powerless. The data tells a different, more reassuring story. According to a prominent prospective study from Tehran, which tracked individuals with thyroid autoimmunity over time, only 9 to 19% of those who have the antibodies ever become hypothyroid. This is a critical piece of information. It suggests that for the vast majority of people, roughly 80 to 90%, the presence of thyroid antibodies does not lead to a failure of the thyroid gland itself. The autoimmunity is present, but it is not progressing to organ failure. This reframes the condition. Instead of a guaranteed path to medication, It suggests that the immune system's activity can potentially be modulated. It shifts the focus from simply replacing hormones to understanding why the immune system is active in the first place, which naturally leads us to the gut, where the majority of the immune system resides. Section 3. The stomach-acid connection, a key mechanism. So, how exactly do autoimmunity and gut health intersect on a biological level? One of the most well-documented mechanisms involves the stomach. The stomach is not just a holding tank for food. It is a sophisticated processing center that must produce a highly acidic environment. This acid serves two primary purposes. It begins the breakdown of proteins and, crucially, it acts as a germicidal barrier. This strong acid sterilizes the contents of the stomach, creating an unfavorable environment for bacteria to survive as they move into the small intestine. Here is where the connection to autoimmunity becomes clear. In some individuals with thyroid autoimmunity, the immune system can also begin to target other tissues. Specifically, about 20 to 30% of those with full-blown hypothyroidism may also develop autoimmunity against the parietal cells of the stomach. These are the cells responsible for producing hydrochloric acid. When the immune system attacks these stomach cells, acid production diminishes. This condition is known as atrophic gastritis or hypochlorhydria, with reduced stomach acid. The natural barrier is lowered. Bacteria and other microbes that were meant to be neutralized in the stomach can now survive and pass through into the small intestine, where they don't belong. This creates an environment ripe for an overgrowth of bacteria. This is why a history of anemia, particularly pernicious anemia, often linked to B12 deficiency from poor absorption, combined with a Hashimoto's diagnosis, can be a significant indicator of low stomach acid. For individuals over 65, the risk of low stomach acid increases further, and when combined with these autoimmune factors, the probability of having a functional issue with stomach acid can be as high as 50%. Section 4. Small Intestinal Bacterial Overgrowth, SIBO, explained. This leads us to small intestinal bacterial overgrowth, or SIBO. To understand SIBO, one must first appreciate the unique role of the small intestine. The small intestine is the workhorse of the digestive system. It is where 90% of caloric absorption occurs. The largest density of immune cells in the entire body resides, making it the central hub of immune activity. It is the primary site for nutrient absorption, and its lining is selectively permeable, making it the most susceptible area to leaky gut. In a healthy state, the small intestine has relatively few bacteria compared to the colon. SIBO is a condition where there are too many bacteria, or the wrong type of bacteria, in this critical section of the gut. For a long time, it was thought that SIBO was solely a bottom-up problem, meaning bacteria from the colon refluxed backward into the small intestine. However, more recent research, including work by gastroenterologists like Dr. Richard McCallum, suggests it can also be a top-down phenomenon. In this model, the overgrowth originates from bacteria in the upper GI tract, the mouth and stomach, that are not being adequately controlled, often due to the low stomach acid we just discussed. This explains the bidirectional relationship between the gut and the thyroid. Hypothyroidism can increase the risk of SIBO by contributing to low stomach acid and slowing gut motility, the rhythmic contractions that move contents through the digestive tract. Conversely, a dysfunctional gut with SIBO can create systemic inflammation and malabsorption that mimics or exacerbates the symptoms of a thyroid disorder. Section 5. Inflammation, motility, and the cycle of dysfunction. It is also important to understand the role of motility. The gut has its own nervous system and a complex network of cells that generate rhythmic contractions to push food and bacteria through the system. When the gut is inflamed, whether from SIBO, food sensitivities, or systemic issues. This motility can slow down. Sluggish motility means bacteria have more time to linger and proliferate in the small intestine. This can lead to a vicious cycle. Inflammation slows motility. Slow motility encourages bacterial overgrowth, and bacterial overgrowth fuels more inflammation. Furthermore, this slowed transit time can have metabolic consequences. When food moves through the digestive tract more slowly, the body has a longer window to extract calories from it. This is one proposed mechanism linking SIBO to weight gain or difficulty losing weight. It's not just about calories in and calories out. It's also about how efficiently or inefficiently the body processes that food through a healthy, well-modeled gut. Section 6. Thyroid hormone conversion and absorption. The health of the gut also directly impacts how the body uses thyroid hormone, whether it's the hormone produced by your own thyroid or taken as medication. First, consider absorption. Most thyroid hormone medication, particularly T4, levothyroxine, Synthroid, is absorbed in the small intestine. If the small intestine is inflamed due to SIBO, ulcers, or conditions like celiac disease, the absorption of this medication can be erratic. This can lead to unstable TSH levels and a need for fluctuating doses. In many cases, once the underlying gut inflammation is addressed, thyroid hormone absorption stabilizes, and the required dose may actually decrease. Second, consider conversion. The thyroid gland produces primarily T4, which is a relatively inactive prohormone. This T4 must be converted into the active T3 hormone in the peripheral tissues. A significant portion of this conversion happens in the liver and the gut. If the gut is inflamed or if the liver is stressed by dealing with the byproducts of dysbiosis, this conversion process can be impaired. This has led to a narrative that everyone needs combination T4/T3 therapy. However, the evidence suggests that only about 10% of people do not adequately respond to T4 alone. For the remaining 90%, the issue may not be a genetic inability to convert, but rather a functional impairment due to poor gut and liver health. Addressing the underlying gut issue should be the first step before assuming a lifelong need for a more complex medication regimen. Section 7. The role of bile in gut ecology. Beyond stomach acid, another crucial digestive fluid is bile. Produced by the liver and stored in the gallbladder, bile acts as a natural detergent to emulsify fats. However, it also plays a role in regulating the gut microbiome. Bile acids have antimicrobial properties. In a healthy system, they help keep bacterial populations in check. However, in the presence of SIBO, the bacteria can deconjugate or break down the bile acids. This renders the bile less effective and can create symptoms that mimic a bile deficiency, such as bloating or fat malabsorption. In this scenario, supplementing with bile might provide temporary relief, but it is treating the effect, deconjugated bile, rather than the cause, the bacteria doing the deconjugating. This is a perfect example of why a functional medicine approach must dig deeper. In some cases, after the bacterial overgrowth is addressed, bile function normalizes on its own. Section 8. A calm look at advanced therapies. The internet is full of discussions about more advanced and often controversial therapies for gut health. It is helpful to look at these with a clear, evidence-based perspective. Helminthic therapy, therapeutic worms. The old friends hypothesis suggests that our immune system evolved alongside parasites like worms, and their absence in modern society may contribute to immune dysregulation and autoimmunity. This is a fascinating area of research. However, in clinical practice with adult populations, the results have been mixed. The most promising data seems to be in pediatric populations, where the immune system is still developing and more malleable. In adults, the response rate has not been consistently impressive enough to recommend it as a frontline therapy. There are also significant questions about dosing, the specific species of helminths to use, and their overall safety profile. While an intriguing concept, it remains an area of early investigation rather than a proven clinical tool for most adults. Fecal microbiota transplantation, FMT. FMT involves transferring the stool from a healthy donor into the gut of a patient to restore a healthy microbiome. The evidence for FMT is stronger than for helminthic therapy, particularly for conditions like recurrent C. difficile infection, and there is promising data for inflammatory bowel disease. However, it is critical to view FMT as an end-of-the-line therapeutic. It is not a first, second, or even third-line option. The logistical hurdles are significant. Finding a rigorously screened, healthy donor is difficult and expensive. The process of administration, whether via colonoscopy or frozen oral capsules, crapsules, requires medical supervision. For the vast majority of people, even those who have seen multiple practitioners, FMT is not the answer. Most cases of gut dysbiosis can be effectively managed with dietary changes, targeted supplements, and lifestyle modifications. The notion that one must jump to FMT is a sign that a proper, stepwise clinical approach has not yet been tried. Section 9. Reevaluating lab testing. A tool, not a master, in modern functional medicine. There is a tendency to treat lab tests as the ultimate arbiter of truth. This is a mistake. A lab value is just one piece of data, and it must be interpreted within the full context of a person's history, symptoms, and response to therapy. Consider a stool test that shows low bacterial diversity. A superficial reading would suggest the need for prebiotics and fiber to feed the good bugs and increase diversity. However, the clinical literature on IBS and IBD tells us that many people with these conditions react poorly to high fiber and prebiotic foods. Their inflammation flares. This is because, in their case, the low diversity is likely a result of an overactive immune system attacking the flora. Forcing more food, fiber, into that environment is like throwing gasoline on a fire. Relying solely on a lab value without understanding this dynamic leads to ineffective and sometimes harmful treatment. A good clinician uses lab tests as a guide, but their primary tools are a thorough patient history and careful observation of how the patient responds to simple, safe interventions. For those exploring gut health, some tests can be helpful when used correctly. A SIBO breath test, such as the glucose or lactulose test from a lab like Aerodiagnostics, can be useful, provided the clinician understands how to interpret the timing of the gas peaks to avoid a false positive. A comprehensive stool test, like the doctor's Data GI 360 or the GI map, can provide information on pathogens and inflammatory markers, but must be interpreted with an understanding of its limitations and the risk of false positives. However, the most valuable test is often a well-designed trial of a foundational intervention, followed by an honest assessment of its impact. Spending thousands of dollars on panels without a clear plan for how they will change treatment is rarely a productive path. Section 10. Dietary approaches. The question of fiber and diversity. The discussion around fiber and dietary diversity is one of the most confusing areas for many people. On one hand, we are told to eat a high-fiber diet to feed our microbiome. On the other, many people find that high-fiber foods make them feel worse. This apparent contradiction can be resolved by understanding the inflamed knee analogy. If you have an acutely inflamed knee, the last thing you should do is heavy, explosive squats. The joint needs rest and gentle rehab before it can handle that kind of load. The gut is similar. For someone with active inflammation in the gut, whether from SIBO, IBD, or a food sensitivity, High-fiber foods, especially raw vegetables, legumes, and whole grains, can be incredibly difficult to process. These foods are the explosive squats for a sensitive digestive system. In the acute phase, a diet lower in fermentable fibers, like a low FODMAP diet, or even a well-formulated elemental diet, a liquid meal replacement, can provide the rest the gut needs to heal. The goal is not to stay on a restrictive diet forever. The goal is to quell the inflammation, then slowly and systematically reintroduce a wider variety of foods. Diversity in the diet and the microbiome is a sign of health, but it is often the result of a healthy, low-inflammation system, not the cause. Trying to force diversity through diet or supplements in an inflamed system is counterproductive. Section 11. The impact of hygiene and modern life. Finally, it is worth considering the broader environmental factors that shape our immune system, particularly as they relate to hygiene. We are living in an era of unprecedented cleanliness. While hand washing and sanitation are critical for preventing the spread of infectious disease, there is a growing concern about the impact of excessive hygiene on immune development, especially in children. The immune system, like a muscle, needs to be exercised. It needs exposure to a variety of microbes, what some have termed old dirt, to learn how to differentiate between friend and foe. Children who are sheltered from all microbial exposure may have a higher risk of developing allergic and autoimmune conditions later in life. There is a limited developmental window for this immune education. For adults, the microbiome of the skin can also be affected by overwashing with harsh soaps, which can disrupt its natural balance and lead to issues like fungal overgrowth. This is not an argument against hygiene. It is an argument for a balanced, common-sense approach. Frequent hand washing after being in public, high-touch areas is prudent. However, obsessively sanitizing after every contact with nature, pets, or your own home environment may be doing more harm than good. The goal is to protect ourselves from new dirt, the pathogens in a public restroom, while welcoming the old dirt of a garden, a forest, or a beloved pet. This balance is essential for maintaining a robust and well-educated immune system for the long term. The single most important takeaway from our time together is this: your body is an interconnected system, and the key to sustainable energy and vitality in your later years often lies not in treating a single blood marker, but in understanding the foundational health of your gut. We invite you to reflect on your own health journey and share your thoughts or impressions in the comments below. Your perspective adds to the wisdom of our community. And if you found value in this discussion, we gently invite you to explore the other videos in our library and to subscribe, so you never miss an opportunity to add to your understanding. This is the Longevity Library. Listen, learn, and live longer.